If you run a dermatology practice in Australia, the insurance requirements of a specialist medical practice apply to you at a level that reflects the complexity of the procedures you perform and the regulatory environment you operate in. Dermatologists perform a range of interventions from diagnostic assessments and biopsies through to laser procedures, surgical excisions, and complex medical treatment, each with its own liability profile and insurance consideration. Here is what covered dermatology practices need, what it typically costs, and how to approach comparing policies. Medical indemnity insurance is the foundational and most important cover for any dermatologist. It responds to claims arising from your clinical work, an adverse outcome from a procedure, an alleged failure to diagnose a skin malignancy, a treatment complication, or a consent issue. Medical indemnity for dermatologists is specialist and should be obtained through a provider with specific experience in dermatology. The level of cover required reflects the procedures you perform. Dermatologists performing surgical excisions, Mohs surgery, or complex laser procedures need higher indemnity limits than those focused primarily on medical dermatology. Public liability insurance covers non-clinical injury and property damage on your practice premises. Waiting room injuries, property damage, or visitor incidents that are unrelated to clinical treatment are public liability matters separate from your medical indemnity coverage. Practice contents and equipment insurance covers your laser equipment, dermoscopy systems, surgical instruments, phototherapy units, and other clinical assets. Dermatology practices invest significantly in diagnostic and treatment technology. An appropriate insurance ensures these assets are protected against damage, theft, and breakdown. Business interruption insurance covers revenue loss if an insured event forces your practice to close. For a specialist practice with long patient waiting lists and a full appointment book, an unplanned closure has significant financial consequences beyond just the days directly affected. Cyber liability insurance is increasingly important for specialist medical practices holding detailed clinical records, histopathology results, and treatment photographs. Privacy law obligations under Australian healthcare legislation and the potential for significant compensation claims from affected patients make appropriate cyber cover a genuine consideration. Workers' compensation is compulsory if you have clinical or administrative staff. What does it cost? Specialist dermatology medical indemnity premiums reflect the complexity of the procedures performed and the claims environment in the sector. Premiums vary significantly depending on your practice profile. Practice contents, business interruption, and other covers add to the total. Work with an advisor who specializes in specialist medical practice insurance. Use the free business insurance finder at Reliable Business Tools to find the right cover for your dermatology practice. Answer a few questions and get matched with relevant options. No obligation.